Hi, I'm Dr. David Hill, and today we're going to be talking about iron allergy signs in babies. So let's stop and say, why would babies be taking iron? Well, breast milk is a great source of iron. So mothers who are nursing rarely have babies who are iron deficient. Babies who are taking formula should be getting a formula that is fortified in iron. In fact, the old low iron formulas that they used to manufacture have been phased out because they didn't help anything, but they did lead to iron deficiency anemia in some babies. So now there's no such thing as a low iron formula, at least certainly not in the United States, formula market. Now, starting at about 9 months, we often screen babies for iron deficiency anemia, usually by checking a hemoglobin here in the office. Why do we care? Well, a couple of things. Poor iron levels, poor blood levels, can lead to weakness, fatigue, poor development, and even behavioral problems. So we like to catch that early and help it out. What do we do if we find a low iron level? Well, the first step is just to use a multivitamin with iron. The good news here is the form of iron in these vitamins almost never causes an allergy. It's really quite rare if it ever happens. So the next level up is to give an iron supplement. Usually we use ferrous sulfate, FeSO4. There are other forms, but that's the most common and the most readily available. Now, some people worry about GI effects. Might it cause constipation? Could it cause upset stomach? The literature is not completely clear on how big a problem this is and how real a problem it is, but certainly it's a major concern for a lot of parents, and it has been reported sporadically by people taking iron. If that's happening, you can certainly ask your doctor, is there a different form of iron that your baby might be able to take, assuming he or she is iron deficient and needs the iron. Now, when we talk about an allergy to an iron supplement, that's really usually limited to IV iron. And unless there's a real problem with iron absorption in the intestine for some reason, IV iron is almost never necessary. The oral iron supplements, in most cases, work just as well. If you're talking about IV iron, you're probably looking at a patient who's going to be hospitalized and under the care of a blood specialist during this procedure. Now, IV iron does rarely cause a severe allergic reaction called anaphylaxis, and that's why we almost always give it in a healthcare setting so that we can monitor the patient for anaphylaxis and make sure nothing nasty has happened. But the good news is, if it turns out that your child needs supplemental iron, they're at very low or infinitesimal risk of having an allergy to that iron supplement, even if they do get a little upset stomach or don't like the way it tastes. Talking about iron allergy in infants, I'm Dr. David Hill.